Morning, good afternoon, and good evening. Welcome to the 875th day of continuous and uninterrupted Zoom session of Ifph. Let us start today's program with a silent prayer for 1 minute. Thank you. Today we have with us Dr. Hubert De Silva as a guest, M.Sc. BHMS, 36 years of experience, the chief editor of Ifph online magazine, and moderator of our webinars. The subject is management of ophthalmological problems with homeopathy. We all know that it's a very important topic and a lot of persons are there. And of course, we all know that the homeopathic therapeutics is rich in this almost all areas, including this ophthalmology. And we have a separate repertoire on that. Repertoire on eye by Dr. Birds. It was published 150 years ago. It mentions about 1,171 medicines. That much vastness and rich is our therapeutics. But we play the second fiddle always because of many reasons. Because we are lacking the enticing advertisements and other sort of activities, and money making business are not with us. That may be the reasons. Anyway, it's a wonderful session we are expecting. On behalf of Ifph, I am welcoming Dr. Hubert De Silva. You can have the platform for the next 45 minutes. It's over to you.
Thank you, Dr. Manesh. Today is a day of thinking about eyes. Everybody having eyes, and those who are not having eyes are in darkness. So, Scripture says, the light of the body. The eyes are like a lamp for the body. If your eyes are sound, your whole body will be full of light. But if your eyes are no good, your body will be in darkness. So if the light is in you is darkness, how terribly dark it will be. Once more, I can read this. The eyes are like a lamp for the body. If your eyes are sound, your whole body will be full of light. But if your eyes are no good, your body will be in darkness. So if the light is in you is darkness, how terribly dark it will be. So we have to make our heart, our eyes bright. So our heart will be bright. We can see everything. Or a few days, I was inside. I experienced a few days practiced in my life, sitting inside the room for some time to know how the things are going on. After a few days, I came back. Then that time only I understand that how beautiful this world is. So everywhere light, everywhere colors, everywhere everything. But in a white room, we are sitting in a white room, we will not see anything. So after coming from inside to out, that time we will be understand that how beautiful this world is made of. Your eyes will always crave for everything to see. That much we know that eyes, it is an important thing because a person's door towards the world is through eyes. If one does not have an eye, so he could not see anything. He do not know how this world is and how this beauty is, how this color is. We cannot say a person who is a blind about colors. He could not understand what is color. A big musician, you know that Jain, so many Hindi music he composed. He composed with Yeshudas so many beautiful musics. But once somebody asked him, what is your important desire for to see anything. If you have getting an eye, what you want to see? But that time he told that I want to see Yeshadas. Because he was composing so many songs, he heard his sound, but he could not see. He's sitting beside him for hours and days, but he could not see how Yeshadas will be there. So that much is important, our eyes. If we don't have, from the beginning of our life, we can see the lights, we can see everything. We can see our mother, children, father and mother, everywhere, our friends and all. We can understand the feelings of others. Without the feelings, without seeing the feelings of others, we cannot understand how to converse with them and how to interact with them. So if we, I know one blind girl. One day, he came, she was my student. Just I am coming to near to her. He said that the star is coming, isn't it? How could he find out that I am coming? But she knows that everybody's footsteps. She can understand from her hearing from others. He could understand that who is coming that. This is another phenomena in this world. If one sense is not working, the other senses will be working more. So let us go to eyes. This is our eyes. Human eye anatomy. These are the parts of our how beautifully constructed this. These are the muscles. This retina, the vitreous body, ciliary body, and sclera, iris, cornea, pupil, lens, ciliary body and muscle, conjunctiva, retinal blood supplies, macula, optic nerve. This is an important nerve, optic nerve. In chickenpox and measles, somebody will not give much importance to this type, these nerves. It may be, sometimes it may be damaged in some cases. If it is not properly, chickenpox and measles are treated, that time it may, some problems will be there, and we can, sometimes even blindness may happen. So human eye. Human eye is roughly 2.3 centimeters in diameter and is almost a spherical ball filled with some fluid. It consists of the following parts. Sclera, it is the outer covering. A protective tough white layer called the sclera, white part of the eye. Cornea, the front transparent part of the sclera is called the cornea. Yesterday I had fever. So today evening at 3 o'clock, 3:30, 4 o'clock, Dr. Danish called me that today's class should be postponed. He could not come because somebody has died. So can you take a class? So I told you that you're okay. I can take this class. So let us go to eyes, sclera, this white part. This is pupil. This is iris. This is eyelid. Somebody having ties on the eye here. We know that small bulging infections, staphylococcal infection may be there. Some patients may have repeated infections of styes. In such cases, what we can do? Pulsatilla, Silesia, Macphos. These are the three medicines we can generally use. If in the first time, if we give potencies of higher potencies of pulsatilla, we can control. It will not separate. If want to separate, that time we have to give Silesia lower potencies. If we give pulsatilla one for some time, the repeated conditions of styes will not occur. I have many experiences. We can treat with Silesia, pulsatilla, and belladonna, Macphos. These are the four medicines which are most useful, and calcarea carb also. What is called eye? Eyes are organs of visual system. They provide living organism with vision, the ability to receive and process visual detail, as well as enabling several photoresponse functions that are independent of vision. Eyes detect light and convert it to electrochemical impulses in neurons. These are main two chambers are there. An anterior chamber here filled with aqueous humor. The posterior chamber contain vitreous humor, majority of the part. Here we can see that nerves, retinal blood vessels, nerves. Here, retina, optic disc. These are the body of aqueous humor. In front of the eye is filled with a clear fluid called aqueous humor, made by the ciliary body. The fluid flows out through the pupil. It then reaches the eye's drainage system, including the trabecular meshwork and network of canals. Here the pressure can be reduced, and in a normal condition, it may maintain its normal condition. What are the two main fluids found in the eye? Fluid fills most of the inside of the eye. The chambers in front of the lens, both the anterior and the posterior chambers, are filled with a clear watery fluid called aqueous humor. The large space behind the lens, the vitreous chamber, contains a thick gel-like fluid called vitreous humor or vitreous gel. Why are tears salty? Tears are all of our other body fluids are salty because of electrolytes, also known as salt ions. Our bodies use electrolytes to create electricity that helps power our brains and move our muscles. Electrolytes contain sodium, which occurs for the saltiness. Yesterday I had fever. Today I have a very tired. I'm very much tired. So I drink 2 glasses of salt water. Immediately my weakness gone. Because that much important is salt. Somebody say that salt is a poisonous thing, but I don't think that salt and sugars are not poisonous. These are very much needed for the body. But it is in a required quantity. If the quantity is more, then it may produce problem. Anything that is more than enough is problem. Otherwise, if it were taken in a normal condition, I usually take more salt than anybody else because always I need salt. If somebody taking, all the persons are taking normal food, but I take in addition to that some more salt. Because I think that in my body, it is very much needed because I am too much sweating person. So I am always sweating. So I should maintain my electrolyte balance in my body. So salt, we are telling about what are the three layers of eye. The wall of the eye, outer layer made of the sclera and cornea called the fibrous tunic. Middle layer made of the uvea called the vascular tunic. Inner layer made of the retina called the neural tunic. We should take importance to understanding these three layers. The wall of the eye, outer layer made of the sclera and cornea called the fibrous tunic. Most infected area, conjunctivitis and everything are attacking this area. Middle layer made of the uvea called the vascular tunic. The inner layer made of the retina called the neural tunic. These three types. One is fibrous tunic. Second is vascular tunic. And the third one is neural tunic. We know that neural means nerves, related with nerves. Retina, an important part of the eye. Here retina. Eyelid, lacrimal coruncle, tear duct, tear duct. If it is dried, then our eyes will not move. Some person may say that some sand in the eyes. There is a feeling of sand in the eyes. Why? This is because of the blood vessels are engorging. The blood vessels of the outer area will engorging. A slight size inflammation will be there. There is a feeling of sand in the eyes. We can use Euphrasia eye lotion. An important, very much we are using, all the doctors are using for so many complaints, we are using Euphrasia eye lotion. It is an important medicine. Euphrasia for cataract and everything. If we are using cataract for several times, we are using the eye lotion, it may clear it. So now let us go to functions of eye. Each eye constantly adjusts the amount of light it lets in, focuses on objects near and far, and produces continuous images that are instantly transmitted to the brain. The orbit is the bony cavity that contains the eyeball, muscles, nerves, and blood vessels, as well as the structures that produce and drain tears. We know that functions. I am not going to say more about it. What are four structures that protect the eye? The orbit, eyelashes, eyelids, conjunctiva, and lacrimal glands help protect the eyes. These are the four areas which protect the eyes. The orbit, eyelashes, eyelids, conjunctiva, and lacrimal ducts. Here is a mechanism. We can see a bulb. While transmitting from here to that light, it may opposite direction in the retina. Then it may reach to, through this optic nerve, it may reach to brain. It is the area, different areas of brain. How many eye functions are there? The eye is a sensory organ. It collects light from the visible world around us and converts it into nerve impulses. The optic nerve transmits these signals to the brain, which forms an image, so thereby providing. Through this area, it may go. How? This can be adjusted all the time. The lens will be like this. It may bigger and smaller. It may bigger and smaller. That pupil are, this iris are contracting and giving all the time. We can see that whenever this is a country in death cases, how to find a case of death. That time we have to watch seriously through our eyes. If there is no movement, that time we will say that there is the patient is died. Otherwise, we cannot say die. But in some cases, I have some experiences. Some sugar patients having cataract because they are blind. How can we see the action of light? In such condition, we cannot say that that person is dead because the eyes will not have action. So what to do in such cases? Death, finding death. Once a person called me, or one person called me to say whether one person died. That time I gone there and I saw that a little bit of movement is there. That time I told them, well, the people are crowded. That time I told them, there, he's there, he's not dead. He's having life. One more month he lived. After that he died. That time also I gone there and I declare the death. So in such condition, this is very much important because somebody will call us to say that to declare the death. In certain conditions, if there is no eye action, what we do, cold water in ears. We will pour cold water in ears. That time, if the person is not dead, we can understand that there will be some movement, cold water. So this is another checking condition. So the areas, the retina, we can see that retina. And through this, all these visions are forming. What are the human eye, the colorful world? I could not understand that. Why this, it is going up and down. The vision, whatever we see, it going inside, it may up and down, it may shuffle. This condition, why, I don't know. Whether you have any, you have to think about it. Why this is happening. So the original thing we can see through our brain. But these are the mechanisms are happening inside the brain. Let us go, what are the conditions of diseases with eyes, common eye disorders and diseases? Refractive errors, age-related macular degeneration, cataract, diabetic retinopathy, glaucoma, amblyopia, strabismus. Healthy eyes are like this. Dry eyes are like this. Cataract eyes are like this. Glaucoma eyes are like this. Pinguicula. I don't know whether the pronunciation is right or not. Pterygium. These are the conditions, the main conditions. A cataract is a cloudy lens. The lens is positioned behind the colored part of your eyes, iris. The lens focuses light that passes into your eye, producing clear, sharp images on the retina. The light-sensitive membranes in the eyes that functions like a film in a camera. In conjunctivitis, we know that the retinas we can see now. Nowadays, there are so many cases of conjunctivitis. We can treat. Which are the medicines? Sulfur, calcareous carb, argentum nitricum, beldola. If there is pain and inflammation, beldola, Silesia pulsatilla. These are the medicines, most commonly used medicines. And cataract. One of our doctors said a few days back, Shalini Fascination, told me that on case, she had on case a person they planned for an operation. They have the date, all are they given date for the operation. And that time, somebody came to her and called her to say, doctor, can you do anything because the operation is planned? So I have fear. So you can do something if you can do. That time she told me that she had given calcareous carb 30 and eye lotion calcareous carb. Within 1 or 2 days, she could see her eye. But it was a miracle. But we have to check it. Most of the doctors should check whether it may happen. Only she told me that 1 or 2 days back, the person came to her and told that I could see. So she again went to some hospital, that same hospital. That time the doctors were not allowing. You had to go for an operation. So she went another hospital, some eye hospital, and they said that she told her that I have to go somewhere, America, so I could not I cannot do an operation. So that doctor said that she checked and said that her eyes is normal. Normally, it will not have any complaint within 1 year. So we should check, all the doctors should try to do calcareous carb 30 taken by inside and outside for external application. 30 is used. Then another condition, glaucoma, cataract. I told you that this cataract, we have medicines for Silesia for a long time. It is written in the Material Medical that long time we have to use for 6 months small Silesia and give Euphrasia or Cineraria martima. What are the signs and symptoms of pterygium? A slightly raised pink growth on your eyes. Red, irritated or swollen eyes. Dry eyes, itchy eyes or burning eyes. Feeling like you have sand or grit is in your eye. Teary eyes. The same medicines we can use. All these medicines we can use. All other set, I already said. Glaucoma is a group of eye conditions that damage the optic nerve. The optic nerve sends visual information from your eye to your brain and is vital for good vision. Damage to the optic nerve is often related to high pressure in your eye, but glaucoma can happen even with normal eye pressure. The most common symptom of pinguicula is a small yellowish patch or bump on the conjunctiva of your eye. What are the signs and symptoms of pinguicula? Red, irritated, itchy, or swollen eyes, dry eyes, feeling like you have sand or grit in your eye, teary eyes. spincicula. This, in this condition. Eye irritation, dry eyes, cataract, healthy eyes. Dry eye symptoms. A stinging, burning, or scratchy sensation in your eyes. Stringy mucus or around your eyes. Sensitive eye redness, a sensation of having something in your eyes. Difficulty wearing contact lenses. Difficulty with nighttime driving. Watery eyes, which is the body's response to the irritation of dry eyes. Once more, I can read this. Dry eye symptoms, a stinging, burning, or scratchy sensation in your eyes. Stringy mucus in or around your eyes, tuja. Sensitivity to light, belladonna. Eye redness, belladonna. A sensation of calcarea carb also can be used. A sensation of having something in your eyes. Difficulty wearing contact lenses. Difficulty with nighttime driving. Watery eyes, which is the body's response to the irritation of dry eyes. The eye is an important and one of the most complex sensory organs that we humans are endowed with. It helps us to visualizing objects, also help us in light perception, color, and depth perception. Understanding a person with just a glimpse of eye. Some person will calculate or perceive that what type of person is like this, how he will think. The perception of a doctor is very much important. Through our eyes only we can see. We can understand the emotions of the other person, the feelings of the other person, to how to console a patient. But all the patients, you just imagine that all the persons, whenever they come into our cabin, they will look the doctor seriously. They will gaze at us. And if we have any doubt of the case, they will understand. Immediately they will understand that doctor could not understand what is my condition. If a doctor is very cool and he just say, okay, we can do something. These are the conditions we can do. Because these are all this through our perceptions we can understand. That is very much needed for perceive. Meditation, meditating about a person, a patient, is very much needed for immediate, we know that we doctors are doing psychiatry and everything. For psychiatry, it is very much needed. We should understand that within 2-3 questions of asking a person, then we should understand that what type of a person he is. What is the way of his thinking pattern? How he is ideologically, he is grown up. If a person is a highly intellectual patient, a doctor, if some doctors may come to for our treatment, that time we should understand that that doctor knows everything more than us. That time we have to say another thing, that if he is not noticed, that time he will understand that this doctor knows what is my problem. So understanding a person is very much needed. A doctor is not understanding a patient, he will fail. So Hahnemannian theories, we know that Materia Medica says how many symptoms. We never think about it. In our thought never come. All these things, everything in minute points are written in Materia Medica. So We have to study materia medica. Then only our dimensions of seeing and the perception and understanding the patient will be more. The eye is the most important optical instrument that detects light. It is an optical instrument. Detects light and sends signals along the optic nerve to the brain. It is an essential organ that gives us the ability to see. It allows light sensing, vision, and differentiating among different colors. What is an expert person and layman? A layman could not understand the things. Then an expert, while seeing a person, he will understand many things. Just seeing a person, we can say that it is through observation we will understand. The old people, we may call our Karnavas, they will say that that person is not right. While only seeing that person, he will say that don't enter him inside the home because he is not, should not be allowed to enter inside the home, because he could understand while seeing that person, he can calculate what is he. That is important. So let us go to other part. These are different types of eyes. Many eyes. Many types of eyes. Spots of vitamin deficiency. Can you see it? I can make it bigger.
Yes, it is visible. No problem.
Visible. Okay. This by chart spot of vitamin deficiency, A deficiency. Cataract. Conjunctivitis. Conjunctiva red. Corneal ulcer. Ectropion. Inflamed. Periorbital cellulitis. Trachoma. Now beautiful, healthy eyes. In these conditions, we can do several things with homeopathy. Almost, I think that 80% can be cured with homeopathy. That is the importance of homeopathy. Stife. I told you that stife. Stife. Then symptoms of keratitis include eye redness, eye pain, excess tears or other discharges from your eye, difficulty opening your eyelid because of pain or irritation, blurred vision, decreased vision, sensitivity to light called photophobia, a feeling that something is in your eye. Styes. Signs and symptoms of a stye include a red lump on your eyelid that is similar to a boil or a pimple, eyelid pain, eyelid swelling, tearing. This is common, most common eye disease. So, pulsatilla, syringia, pulsatilla, Ornum or more than higher potencies, and calcarea carp. When it is started, that time calcarea carp ornum or pulsatilla ornum will immediately abort the condition. And Silesia ornum we can use. To hasten separation, Silesia smaller potencies That is, I think that it is not better. We can do it. This, what I said. The term refractive errors refers to four conditions: astigmatism, objects up close and at a distance appear blurry; hyperopia or farsightedness, new link to be created, close objects seemed out of focus; myopia, nearsightedness, distant objects look out of focus; presbyopia. These are all refractive complaints. So these are all doing with glasses, can be adjustable with glasses, eyeglasses. These are the, in such conditions, the focusing will not be in the area of retina. Then it may go, some may go outside. Normal eye having the eyes, the reflection will reach the retina. In other condition, it may in the short-sightedness, it may in the middle or that area. It may in some time, it may go out. That time we may use lenses to correct the things. Uses convex lens, cylindrical lens, and concave lenses are used to correct, to get the focus in the area. So in such some conditions, it will not be much healthier. That time, in Materia Medica, it is said that the gelsemium will sometime it may give some help in some conditions of this adjustment will not take place, and so that condition it may get some relief. So these are the conditions I want to say. Let us go to some. These are the medical conditions. Some medicines we can let us go. Calcarea carp. Eyes. Sensitive to light, lacrimation in open air and early in morning. Spots and ulcers on cornea, lacrimal ducts from exposure to cold. Is fatigue of eyes, farsightedness, itching of lids, swollen, scurfy, chronic dilatation of pupils, cataract, dimness of vision, as if looking through a mist, lacrimal fistula, scrofulous ophthalmia. I told you that refractive cases, it will give some help. Then other one is causticum, cataract with motor disturbances, inflammation of eyelids, ulceration, spark and dark spots before eyes, paralysis of ptosis, gelsemium, vision impaired as if film were before eyes, paralysis of ocular muscles after exposure to cold. Another medicine is gelsemium. Ptosis, eyelids heavy, patient can hardly open the double vision, disturbed muscular apparatus, corrects blurring and discomfort in eyes even after accurately adjusted the glasses. Vision blurred, smoky, dim-sighted, pupils dilated and sensitive to light, nervous problems. Orbital neuralgia with contraction and twitching of muscles, bruised pain back of the orbits, one pupil dilated, the other contracted, deep inflammations with haziness or vitreous, serous inflammations, albuminuric retinitis. This is a condition, just watch carefully. Albuminuric retinitis, detached retina. It is a serious condition. Glaucoma and disseminated hysterical amblyopia. Hysterical amblyopia, gelsemium. This arnica. Arnica. Diplopia from traumatism, muscular paralysis, retinal hemorrhage, bluish sore feeling in eyes after close work. Must keep eyes open, dizzy on closing them, feel tired, and very eyes. Then these are the medicines. Then argentum nitricum. For somewhere I read this strangulation of vessels of the blood vessels, argentum nitricum. These are other things we can just go through it. Other medicine, eye bright, euphrasia, an important medicine. Most of the doctors are using. The other medicine is naphthalene, marked affinity for the eyes. It produces a detachment of the retina. Capilloretinal infiltration deposits in patches upon the retina, amblyopia, and consecutive amaurosis, sparking syncytial, soft cataract, exudation in the retina, choroid. I never used this medicine, but I just showing you. But other medicines I used, I got result, but I never used this medicine. You can try it, naphthalene. Then silesia, an important medicine. Silesia. Silesia, 30 potencies are they are advising us. Yes, these are all. Thank you very much for hearing. Now the time for discussion. Don't ask cruel questions.
Okay.
Okay,
Nice presentation, because we have to do some short-term arrangements with some other problems to continue the program. Anyway, Dr. Hubert De Silva maintained or managed it well, I think. Time for discussion. Those who would like to participate, please go to the participants and raise your hand. A lot of topics are discussed. I think you should have been present in 2 or 3 sessions. Then it will be more beneficial. There is no need of rushing through these topics, because as initially you said about the importance of eyes, what is what happens, and what is the role of the eyes, as you got it from Bible, I think. Then just I mentioned that initially, because there are only 10 or 15% at that time, we have a lot of medicines are there, especially property is also there, property of eyes by birds, where you can see 1,171 medicines. That much rich is our material and our therapeutics. I don't think many other systems of medicine can have that much of number of medicines, because these were all the proved medicines, scientifically proved medicines, and of course effective too, not at all producing any type of side effects. If anybody would like to participate, you can have some additions or some doubts you can clear with Dr. Hubert De Silva.
I think that it is better to add something from the doctors. Yes. That is what I requested to doctors, because there are so many doctors are in our
of course
platform.
We have Sridharan Saab to add something. Definitely, there is whatever may be the chapter and topic, Sir will have something to add. Sir, please.
Yes, I am not going to ask anything. I am going to add only.
Yes,
first, that I started treating that diplopia with Gelsimi, which is a #1 medicine for diplopia. Any type of the diplopia. Even so far, I have not paid even single case. That diplopia, so many cases I cured with Gelsimi. That is my experience. Another one is that bleeding in the eyes, phosphorus 0/3 potency, it is cured so many cases, especially in diabetes, that capillary bleeding can be stopped with the phosphorus. That then very few cases only I was able to cure that the cataract. It cannot be completely cured, but it can progress can be reduced by that. Also I give phosphorus only, and such type of, then the conjunctivitis, such things that already. And once that when you are welding machine using the night, there was one person was called that his mother-in-law is a homeopathic doctor. He called in the midnight. First I thought she was unknowingly called me. It was about 1:30. But 2 o'clock again she called. Then I understood that it is some emergency. I called and I asked her to give Bellona 0/3 continuously 10-15 minutes, not putting inside the parampos, that she was not having uprasia or cynorrhea. So I don't advise cynorrhea or uprasia for only alcohol free. Only I will advise. That I advised there was parampos 6 was made powder, and it was filtered and put to that. Within 1 hour he slept. That next day, 10 o'clock, he called me that, sir, I slept and morning there was nothing. Everything was okay. Like that, in eyes, so many things we can do it wonderful. But and another area is thighs. That Staphysaccarea, Persatilla, etc. are very wonderful remedy that everyone knows very well. So I am not going very deep. The others may also to speak. Thank you. Your excellent presentation. You must not have only eyes. It must seen properly. Then only you can understand all these things. Thank you.
Thank you, sir. Thank you, sir.
Okay.
കണ്ണായ കണ്ണിനു മനമായ കണ്ണതിനു കണ്ണായിരുന്നപ്പോൾ താനും ഉറക്കുവള ആനന്ദ ബന്ധുഹരിനാരായണ. So it means we have the mind. Yes, we have the eyes. We have the eyes, but we have the right presence of mind. Even though the mind is there, it will not work. The consciousness should be there. Then the consciousness depends upon the soul. That's the most. That is the thing you at first explained. Dr. Hubert knowingly or unknowingly explained initially.
Thank you.
The darkness of the eyes, without having the soul, the consciousness, there will be darkness. That you just mentioned initially. Clear?
Yeah, now I understood.
Yes, that is most important thing. Yes, of course, the homeopathy is a system of medicine that always have some philosophical aspect. We are always dealing with some subtle effects, subtle body, subtle form, subtle energy. So just like the life force and the vital principle, the difference between the vital principle and the vital force. One is the simple substance, the other is the manifestation. That's the difference. The vital force is the manifestation of the vital principle. That's the difference. Yes. Anyway, if anybody would like to participate, you can ask something or for minutes remaining. Then I think there is a couple of medicines for presbyopia. Majority of persons are suffering from presbyopia after 40. In the class material medication, repertory, clinical repertory by Clark. He mentioned about 3 or 4 medicines. I think one is the Natrangarb, another one is the Onosmodium. Only in that book I saw all these things. Then regarding the injury to eyes, a lot of scope for homeopathy. Of course, we can the ledam, arnica. Then of course the sulfuric acid is a good medicine to absorb. Then ruta, natramor, especially those who are always using the screen, the mobile phone or the laptops. Arnica, you can see in the Kent's material, you can repertory by viewing the moving pictures, pain the eyes. The medicine is arnica.
Somebody
So
asking.
Yes?
Somebody asking for treatment for chronic styes.
Yes,
That's I
yes,
told you that it is Pulsatilla Varnam, Sailisha Varnam.
Toja is another medicine. Then
This is to give for some time it may control.
Yes.
Many patients say that after taking that medicine never came that condition.
That's
So
good.
we can use higher potencies, not lower potencies.
Then have treatment of optic nerve dry. What is that?
Optic nerve drive. That time we have to do some treatment for. We cannot say that we can completely cure, but In such conditions, we have to supplement other nutrition supplement is very much needed. In
Another
addition to
question,
that,
yes. Difference between chalazion and stay.
I don't know. Salasium. A new word. Styes, I know.
Yes, you just mentioned, yes. Then another is phosphorus. What is that? Then you can directly ask to Dr. Hubert De Silva instead of make some messages. Okay. Dr. Hariharan sir. Yes, Dr. Rajeshwari is right side. Dr. Rajeshwari. Yes. Please.
Unmute you.
You can unmute now, Dr. Rajeshwari.
Okay, sir. Chalazion is it's not infectious. It is not a painful condition. Okay, right.
Okay.
All right. Stase is a painful condition and it is a bacterial infection.
Okay. Okay. Thank you. Thank you for the information.
I think a phosphorus is better for this optic nerve atrophy or dryness. It is better. Phosphorus.
Phosphorus. Okay.
Oh, there
Thank
is
you.
another. A more clear answer is given by Dr. Gigi Chandran in the chat box. You can see it. So there are a lot of medicines, a lot of conditions are there. I think only we have to make more specialists on these subjects because we have a lot of medicines. If you study a particular subject more deeply, that will benefit homeopathy. Hariharan sir, yes sir, what is your opinion? Another legend from, yes sir. Please unmute, sir. He was very busy with his sessions. Dr. Hariharan, sir, please. Yeah.
Okay, Doctor. I am not a legend, but I have some ad for this clinical therapeutics. See, cranial nerve disorder. One of the best medicines is agaricus. Agaricus is one of the best medicines. See, certain other medicines I like to see inflammation of the eyes, trisobinum 30 you give, it will give good result. See, dropping of eyelids. No, gelsemium and causticum.
One
See,
question.
dissimilar eyes. Sculla 3x you give, dissimilar eyes. Certain patients have dissimilar eyes.
Hariharan, sir, here's a question for you.
On question,
Sir.
hair falling eyebrows, syphilinum.
Hair falling.
Syphilinum and Thuja, syphilinum and thyroid. These are the medicines I am using and I'm getting good result.
Sir,
Some other medicines are there or
Yes,
okay.
yes, sir. Hariharan, sir, please.
Syphilinum is
Sir,
one of the main.
sir,
Yeah.
see, falling of hair of eyebrows is a syphilitic miasm.
Yes.
So you give syphilinum and dose. That will give you best result. See, corneal abscess. You give silicea 1 dose.
Yes,
You
sir.
give.
Yes, sir. We can have a session from you. I expect time for to.
A lot of medicines.
Yes.
A lot of medicines
Yes,
we
sir.
have.
Yes,
We
sir.
have.
Yes, sir. You can complete today's program with a word of thanks to Dr. Hubert De Silva or dear De Silva. Yes, please.
Okay. It is usually it is my duty to say what of thanks to Dr. Hubert. Then I will usually say about dopamine. Always laugh. It is showing that his mind. It is showing that his mind. It is a mirror. See, mirror. One of see face. One the. Yes, that is what I like to say. His face is the mirror of your mind. Okay, Dr. Silva, Dr. Hubert. See, you are today. You have done an arrangement for this clinical class. That means you are very well studied these things. So you conducted the class. Anyway,
Yes.
we are indebted to you. Okay, thank you very much. Come again with another subject.
Okay. Well, that must end today's English session. Hope you to be the same day tomorrow. Till then, goodbye. And it is all Dr. I.R. Kumar to continue the program in Malayalam. Thank you.